Welcome to the 21st Century Man podcast. We're starting a deep dive series into the book, The 21st Century Man, chapter by chapter. And today we're hitting a really important one, lowering the risk of a stroke.
Yeah, great to be diving into this. It's definitely a critical topic. The authors kick things off with that Carl Sagan quote, the brain is like a muscle,
Yeah.
which feels good when we use it.
Mm.
But as this chapter makes clear, it's also quite vulnerable.
Oh, absolutely. And that story about Michael Johnson's Superman getting a stroke at 50, that really hits home. I mean, if it can happen to an Olympic legend.
Exactly. It shows stroke doesn't discriminate. And his recovery, even with top medical care, was tough. It just underlines the seriousness, which is, I think, the author's point right from the start.
Right. Brott, Fess, and Dr. Brandeis really emphasize that strokes are a huge cause of long-term disability here in the U.S. So our mission today basically is to pull out the key stuff from this chapter for you, make it useful.
Make it actionable, yeah.
Yeah.
Distill it down.
Okay, so first things first. The chapter defines what a stroke actually is. Can you break that down simply for us?
Sure. Think of it like this. A stroke is basically a sudden plumbing problem in your brain. The arteries carrying blood get blocked or one bursts. So the vital stuff, oxygen, nutrients, it just gets cut off from reaching brain cells.
And the clock starts ticking immediately then, doesn't it? What happens when that supply line gets cut?
Yeah, time is absolutely critical. Brain cells, they start dying really fast without that oxygen. And depending on which part of the brain loses blood flow, you lose the functions controlled by that area. It happens quickly, and the damage can be, well, significant.
The book gives some pretty stark examples based on where the stroke hits.
It does. Like if it's the occipital lobe back of the head, that could mean blindness. The parietal lobe kind of top and side. That affects speech, even how you think. And a common one, if the right side of the brain is hit, you often see paralysis on the left side of the body. Maybe you can't walk, need help with everything. It really shows how life-altering a stroke can be. Permanent disability, reduced quality of life. It's serious stuff.
Definitely. Okay, so since they can happen out of the blue, recognizing the signs is crucial. What are the major symptoms we need to know?
Right, they often come with no warning. So watch for sudden things, sudden numbness, especially just on one side of the body. Or sudden weakness, maybe the face droops, or an arm or leg just feels weak. Again, usually one-sided.
Sudden confusion too, right? Like trouble talking or understanding.
Exactly. Sudden confusion, difficulty speaking, or seeming unable to understand what someone's saying. Also, sudden vision problems, blurred vision, double vision, even temporary blindness in one or both eyes.
Okay, what else?
Sudden trouble walking is a big one. Dizziness, loss of balance, feeling uncoordinated. And sometimes a sudden, really severe headache with no obvious cause. Any of those things pop up suddenly, you need to think stroke.
Which leads us straight to the FAST test. The book highlights this as a simple, vital tool. Can you walk us through FAST?
Yeah, FAST is brilliant because it's easy to remember in a panic. F is for face. Ask the person to smile. Does one side of their face sag or look uneven?
Okay, yeah, face. Got it.
A is for arm. Ask them to raise both arms up. Watch them. Does one arm start to drift downwards?
A, arms, right?
S is for speech. Get them to repeat a simple sentence like, the sky is blue. Listen carefully. Is their speech slurred? Are they using weird words or can they not speak at all?
S, speech. Makes sense.
And then the most important letter, T is for time. If you see any of those signs, the face drooping, the arm weakness, the speech trouble, you need to call 911 immediately. Don't wait.
Time is critical. That's the takeaway.
Absolutely. Every single second counts. Getting to a hospital fast means they might be able to use clot-busting drugs. Those drugs can literally save brain tissue, save function, potentially save their life, but there's a narrow window.
Okay, now the chapter also talks about something called a TIA, or mini stroke. What's that about?
Right, TIA stands for transient ischemic attack. Think of it as a temporary stroke. The symptoms are the same, numbness, weakness, vision problems, speech difficulty, but they usually disappear pretty quickly, often within an hour, sometimes just minutes.
So the blockage clears itself.
Basically, yeah. A small clot blocks the vessel temporarily, causes symptoms, but then it breaks up or moves on, and blood flow returns to normal. But here's the crucial thing the book stresses. A TIA is a massive warning sign.
A warning sign for what?
For a major stroke. The stats are sobering. Something like 1 in 3 people who have a TIA will have a full stroke soon after, sometimes within days or weeks.
Wow. So even if the symptoms go away, you absolutely cannot ignore a TIA.
Definitely not. You need to get checked out right away by a doctor or go to the hospital. It's your brain sending up a flare, saying, hey, something's wrong here, and a bigger event might be coming.
Are there any other maybe less common TIA symptoms mentioned?
Yeah, the book lists a few others you might not immediately connect to stroke. Things like a sudden racing or irregular heartbeat, maybe some chest pain, angina, sudden confusion that clears up, a really unusual or intense headache, or even symptoms of shock, like sudden sweating, dizziness, or feeling faint.
So the bottom line is, any sudden, unexplained neurological symptom like that, even if it's temporary, needs immediate medical attention. Call an ambulance.
Precisely. Don't try to tough it out or wait and see.
The statistics the chapter presents on stroke prevalence are, well, they're pretty stark.
They really are. Almost 800,000 strokes a year in the U.S., plus maybe 500,000 TIAs on top of that. And the impact on quality of life, it can be more profound than almost any other injury or illness.
And it leans towards older adults and men, right?
Yeah, over 70% of victims are over 65, and nearly 60% are men. And sadly, men tend to die younger from heart disease and stroke overall.
And the disability rate among survivors is concerning, too.
Incredibly so. Nearly a third of survivors end up so disabled they can't care for themselves. It just drives home that point about getting help fast. That 3-hour window the book mentions for treatment often leads to significantly less disability down the road.
Okay, so we know what it is, how to spot it. Let's talk about how strokes happen, the mechanics behind it.
Right, so as we said, it's either a blockage or a burst blood vessel in the brain. Either way, brain cells get starved of oxygen. And unlike, say, skin cells, brain cells generally don't repair or regenerate well once they die. That damage is often permanent.
And the chapter breaks it down into two main types.
Correct. Based on CDC data, about 87% are ischemic strokes. Those are the blockages, and about 10% are hemorrhagic strokes, which involve bleeding.
So ischemic strokes, the blockages, what causes those?
It's usually a blood clot. It can form right there in a brain artery, often where there's already some plaque buildup that's a thrombotic stroke. Or, and this is really common, the clot forms somewhere else, like the heart or a major artery in the neck, breaks off, travels through the bloodstream, and gets stuck in a smaller brain artery. That's an embolic stroke. The book notes about half of ischemic strokes are these embolic ones.
Okay, and hemorrhagic strokes, the bleeding ones.
That's when a blood vessel within the brain actually ruptures and bleeds into the surrounding tissue.
Yeah.
Or it could be bleeding in the space between the brain and the skull. Sometimes it's caused by an aneurysm, a weak balloon spot on an artery wall that bursts. The blood itself then damages brain cells and increases pressure inside the skull, which causes more problems.
Understanding those differences is helpful. Now, the book spends a good chunk of time on risk factors, organizing them really well. Let's start with the primary ones.
Yeah, these are the big hitters. Number one, hands down, is hypertension, high blood pressure. It's the leading cause, and it basically doubles your stroke risk. Huge factor.
Doubles it. Wow. Okay, what's next?
Tobacco use. Smoking. The stats here are just, well, stark. Over a pack a day, your risk shoots up by 250%. Even less than a pack a day still doubles your risk compared to a non-smoker.
2.5 times the risk. That's massive. Okay, primary risk factor number 3.
That's the combination of obesity and diabetes. And the book quotes a really worrying statistic. 2 out of 3 people with diabetes end up dying from a heart attack or stroke. It really highlights how interconnected these conditions are with cardiovascular health, including stroke.
Okay, so those are the big 3 primary risks. Then the chapter moves to known risks, things we can't change but need to be aware of.
Right. Age is the big one here. Risk just naturally goes up as we get older. Then there's genetics and ethnicity. The book mentions higher risk for Hispanic individuals, people with Mediterranean, Middle Eastern, or Asian ancestry. And it specifically calls out this significantly higher risk for African American men, almost double the risk compared to white men, plus the highest death rate.
That's a really important point about health disparities. What about family history?
Yeah, that falls under known risks too. If stroke or heart disease runs in your family, it could be genetics, but it could also be shared lifestyle factors. Diet, exercise habits, smoking exposure. So if that's your situation, the book advises having a detailed chat with your doctor to figure out your personal risk.
Makes sense. Okay, next category. Health issues that raise risk, but many of these are potentially manageable. High blood pressure comes up again.
It does, because it's just so prevalent. At least a quarter of adult men have it, and it's such a major driver of both stroke and heart attack. Constant pressure damages arteries over time.
And diabetes again, too, right? How does that connect?
High blood sugar damages blood vessels and contributes to atherosclerosis. That's the buildup of fatty plaques inside arteries. It makes them narrower, stiffer, and more prone to clots. The chapter even hints at the link between simple sugars in our diet and the body making harmful fats, pointing to more detail later in the book.
So that plaque buildup itself is another health issue mentioned.
Exactly. Atherosclerosis, or hardening of the arteries. It restricts blood flow, obviously. But the real danger is when a piece of that plaque breaks off or the plaque ruptures, which then triggers a blood clot to form right there. That clot can block the artery or travel to the brain.
Heart arrhythmias are also on the list.
Yeah. Irregular heart rhythms like tachycardia, which is a fast heartbeat, or mitral valve prolapse, where a valve doesn't close right. And especially atrial fibrillation, or AFib, that's a big one. These rhythm problems are thought to be involved in maybe a quarter of all strokes, often because they can allow clots to form in the heart, which then travel to the brain. AFib gets more common with age, but the others can happen earlier.
The chapter also mentions sickle cell anemia and low testosterone.
Right. Sickle cell is a genetic condition that affects red blood cells and increases stroke risk. And low testosterone. Well, studies suggest a link to higher risk of cardiovascular problems, including stroke, and maybe slower recovery too. Plus, low T often goes hand in hand with other risk factors like obesity and high blood pressure.
Okay, final category. Lifestyle issues. These are the things we often have the most direct control over. Smoking's back again.
But with good news this time. Quit smoking, and after about 10 years, your stroke risk drops back down to the level of someone who never smoked. That's huge motivation.
Definitely. What about nutrition? The EPIC study is mentioned.
Yeah, that huge European study found clear links between eating more fruits, vegetables, fiber, and dairy and having a lower stroke risk. The book gives examples, like half a pound of fruits and veggies a day, a salad, and some cooked veg cut risk by almost 15%. Double that, maybe an apple and a bigger salad, and the risk reduction was around 30%. Simple changes, big impact potential.
And just drinking water seems important too.
Surprisingly significant, yeah. The research cited suggests drinking at least 5 8-ounce glasses of water daily cuts stroke risk by over half compared to drinking less than 3. Seems basic, but staying hydrated looks really protective.
How about alcohol? The advice seems to have shifted on that.
It has. The idea of moderate drinking being heart healthy is being questioned. The chapter says recent findings suggest even 1 or 2 drinks a day might increase stroke risk by maybe 10–15%. And heavy drinking definitely raises it, maybe by 35%, partly because it affects blood platelets and clotting.
Chronic stress is another one. How does that play into stroke risk?
When you're constantly stressed, your body stays in that fight or flight mode, high heart rate, high blood sugar. Over the long haul, that wears down your cardiovascular system and can contribute to high blood pressure, diabetes, and ultimately stroke.
Dental health seems like an unexpected link.
It does, but there's growing evidence connecting poor oral health, especially gum disease, to heart disease. Since heart disease is a stroke risk factor, taking care of your teeth and gums seems to be another piece of the prevention puzzle. Inflammation might be the key link there.
And the book briefly mentions street drugs and then some prescription drugs too.
Right. Street drug use carries many health dangers, including increased stroke risk. For prescriptions, the chapter flags a few types where studies have shown potential links. Anticholinergics used for allergies, Parkinson's, some heart issues showed increased risk in one long study. Benzodiazepines, like Valium or Xanax, have been linked to clot-related strokes, especially with high use.
Even blood thinners. That seems counterintuitive.
Yet paradoxically, while they prevent certain clots, they might slightly increase the risk of bleeding strokes in some cases. And NSAIDs, common pain relievers like ibuprofen or naproxen, have also been linked to increased cardiovascular risk, including stroke for some people. The main message here is you really need to talk openly with your doctor about everything you take, prescription or over-the-counter.
Absolutely. So, given all these factors, the book suggests maybe looking beyond standard lab tests.
Yeah, the usual cholesterol panels, blood sugar tests, C-reactive protein, they're important. But the authors suggest discussing a few others with your doctor if you're concerned.
Like what?
Well, checking your testosterone level, given that link we mentioned. Testing for homocysteine high levels are linked to risk and can sometimes be lowered with B vitamins. There's a test for oxidized LDL, which measures a particularly damaging type of cholesterol linked to oxidative stress. And a D-dimer test, which looks for byproducts of clot breakdown high levels, might suggest a higher tendency to form clots.
Good to know about those options. The book then really focuses on atrial fibrillation, AFib, as a major, sometimes hidden cause.
It really does. And the statistic is staggering. An AFib-related stroke happens every 12 seconds in the U.S. AFib is that irregular, often rapid heartbeat. It's the most common persistent arrhythmia, affecting millions.
What increases the risk of getting AFib?
Things like getting older, genetics, smoking, too much alcohol or caffeine, high stress. Also, having existing heart disease valve problems, past heart attack or surgery, definitely bumps up the risk.
And other conditions can contribute too.
Yes, the book lists several others. Certain types of tachycardia, mitral valve prolapse, heart defects you're born with, heart failure, cardiomyopathy, blood clots in the lungs, chronic lung disease. All these can increase AFib risk and therefore stroke risk. Some arrhythmias are harmless, but AFib isn't one of them. It seriously raises the odds of stroke, heart failure, even cardiac arrest. Chapter 6 in the book apparently goes into more detail on AFib.
Okay, shifting gears a bit towards the end of the chapter, it touches on newer treatments for recovery after a stroke. It stresses that recovery is complex, needs professional guidance.
Absolutely. Physical medicine and rehabilitation specialists, TM&R, are key. But the book also empowers survivors and families to look into other science-backed options that might help alongside standard rehab.
What kind of emerging therapies does it mention?
One is acupuncture. Ancient practice, but modern research shows it can be helpful for neurological recovery after stroke and even help lower blood pressure. It's becoming more accessible, sometimes even covered by insurance. Finding an experienced practitioner is key, of course.
Then there's hyperbaric oxygen therapy, HBOT.
Right. Breathing pure oxygen in a pressurized chamber. It's FDA approved for things like wound healing. Dr. Paul Hart's work applying it to brain injuries, including stroke, is highlighted. He sounds very positive about its potential. Availability for stroke might be more in private centers than hospitals right now, but it's something the book suggests exploring post-stroke.
And the third one was RTMS, repetitive transcranial magnetic stimulation.
Yeah, that's a more high-tech therapy using magnetic pulses to stimulate brain areas. It's used safely for depression and other conditions, and many trials have looked at it for stroke recovery. The book mentions a study showing benefits even years after a stroke. It usually requires a neurologist or psychiatrist referral. The authors recommend a book called The Angel and the Assassin for more on this.
Beyond those medical therapies, the chapter ends with practical things people can do themselves for recovery once they get the okay from their doctor.
Exactly. Things like meditation and breath work, good even if mobility is limited. Walking, huge benefits for the brain, but safety first. Use a walker or have help if needed. And gentle movement practices like yoga or Qigong, again, focusing on safety and comfort.
This chapter is just packed with invaluable information. Armin Brott, Nancy Fass, and Dr. Judson Brandeis have done a fantastic job making this complex topic accessible.
Totally agree. It's clear, practical, and empowering. We really do recommend reading the whole book, The 21st Century Man, to get the full picture on men's health today.
Well, we really hope this deep dive into Chapter 14 has given you some valuable takeaways and things to think about for lowering your own stroke risk. Knowledge really is the first step, isn't it?
It absolutely is. Please join us next time on the 21st Century Man podcast. We'll be tackling the next chapter, Chapter 15, The Alzheimer's Tsunami. We look forward to exploring that with you.